Today we're going to be talking about bipolar disorder. This is going to be the last of the mood disorders that I'm going to discuss before I get into some other type of material. All right, anyway, today we talk about bipolar disorder. From a psychological point of view, bipolar disorder has two different types. There's bipolar 1 and bipolar 2. In bipolar 1, the prominent feature is mania. That is an individual having a manic episode. With a manic episode, they have a feeling or a mood that is explosive, persistently elevated, or irritable. And in bipolar 1, they also have depression. They may have depression, as a secondary type of symptom. In bipolar 2, the primary symptom is depression. That's the primary thing. There may be, not necessarily has to be, but there may be 1 or 2 episodes of mania, or what we call a hypomanic state. Now by hypomanic, it's a distinctive period of persistently elevated, expansive, or irritable mood lasting 4 days or longer. During this period of 4 days, there are specific symptoms that we will see. An inflated sense of self-esteem or grandiosity. Decreased need for sleep. A person that is in a manic phase can go 2 or 3 days without any sleep. They're generally more talkative than usual. They are also prone to distractibility, more so than other people would ordinarily be. There's an increased need, number 5, an increased need for goal-directed activity, such as work, or shopping, or sex. So in other words, they can have anything that they actually focus on, that they include in their bipolar episode. They're going to go with it 100 miles an hour. Anything from shopping to sex. If it's shopping, they're going to spend all your money. They're going to spend every dime that they can get their hands on. All right. If it's sex, they're going to have promiscuous sex all over the place. They also have, number 6, a flight of ideas. In other words, they will go from one topic to another. They won't stay on one topic. They go from one topic to another. We call that a flight of ideas. And accessible activity and pleasurable events, which could include sex or shopping or anything else that gives them a sense of pleasure. Women who struggle with bipolar disorder, especially that with in bipolar 2, have a higher level of depression than most anybody else. Because they have a higher level of depression in bipolar 2 than is ordinarily found anyplace else, they may struggle intensely with feelings of sadness, helplessness, hopelessness. They are also vulnerable to self-harm and suicide. The patient that experiences this type of depression can be helped with antidepressant type of medications. The only problem is if the patient's problem is bipolar disorder instead of major depressive disorder, then during the course of their treatment, if they're put on antidepressant medication, during the course of that treatment, they can actually have a manic attack. And so the physician has to be very careful in how they treat or diagnose this disorder, because a lot of times it's very easy to see that a person with bipolar disorder who is only going through the depressive phase of that disorder looks like major depression, and it's not major depression, it's bipolar disorder. So the clinician has to be very careful to diagnose this correctly. Okay, so at any rate, that's kind of in the nutshell what it's like to suffer from bipolar disorder from a clinical point of view, from the book point of view. I also want to point out, hold that thought. I also want to point out that all of the symptoms of all mental illnesses can be found in what we call the DSM, Diagnostic and Statistic Manual. This is version 4. There are 5 or 6 different versions. I just have different version 4, and most of them have the same symptoms from one version to another. So there's not a whole lot of difference. But at any rate, this is the book that all mental health professionals use in order to diagnose any type of mental disorder. The DSM, Diagnostic and Statistical Manual. All right, so this little talk about bipolar disorder will bring to a close my discussion of mood disorders for the purposes of this series of seminars or videos. Next, I'll be talking about some of the interventions that are used for these disorders, that is the medications and the type of treatment used for mood disorders in general and specifically for bipolar disorder. And I also want to talk to you about what mental illness looks like to people that actually have a mental illness. You know, for instance, with bipolar disorder, a lot of times you will see a person have some kind of feeling or emotion that is inconsistent with what's going on around them. You know, in other words, they can get a promotion at work and feel depressed. They can hear about a tragic event of a friend and be almost giddy or happy, you know. And the reason for this, the way I understand it, just from a layman's point of view, is that the person with bipolar disorder has what can be thought of as a short circuit in their brain, where emotions are being triggered that have nothing to do with what's going on around them. So that's something else you need to know about bipolar disorder. Now, I thought it might be interesting to talk about what it's like for an individual to even have a mental illness. Okay, so I will discuss that next week. Until then, take care. Thank you for dropping by. Bye now.